Welcome to Innovations in Critical Care Education. My name is Stephanie Pierce, and there I am. I received my RN in 2014 when I graduated from Excelsior with my ADN. I then continued my education through Excelsior, working to the point where I am now. I started off my career on a general med surg floor where we took care of everybody. It was in a small rural hospital, so I took care of pediatrics, telemetry, general surgery, orthopedics. It's kind of a catch-all floor. And I also was telemetry trained there. After about a year on that floor, I moved on and started working in the emergency department, which was kind of my goal. Emergency is where my heart is, and that's kind of where I have focused most of my attention. So, hello. So now getting into my project. The problem that started my project was the number of new graduate nurses that were going straight into critical care roles. So traditionally, in order to be considered for a position as a nurse in the critical care arena, one would need to have some experience. Unfortunately, we've had many nursing shortages, and so facilities no longer have the luxury of experience. So the focus for staffing has transitioned from experience to education of the new graduate. The new graduate nurse orientation to any facility needs to be intact, but with those critical care roles being where they're directly transitioning into, there needs to be a more specific curriculum and a way for them to apply that practice in a safe, risk-free environment. With the improvements in technology, the use of different teaching modalities such as YouTube and Glaxter paired with the use of simulation in the education of the critical care nursing has proved very beneficial in this aspect. So without that basic knowledge of the critical care role, so going through nursing school gets you the basic knowledge to become a nurse, but you're not necessarily taught how to apply it as well. And then you're taking that and going directly into critical care nursing. So what's happening is we're not getting properly trained critical care nurses. There's a higher rate of job burnout and job dissatisfaction, which leads to the burnout, and then an increase in turnover rates. Studies have actually shown that the first year post-graduation is the most stressful, and research has brought focus on the gap between the theory versus the practice of knowledge, skills, and clinical thinking. So these new graduate nurses are going into these critical care roles, and they're almost going into shock with the reality of the workload. And because of this, we show that the studies are showing that 35 to 61% of new graduate nurses leave their first job within their first year of practice. So how do we fix it? Our key stakeholders in this are going to be the new graduate nurses themselves. They are having the theory practice gap when it comes to knowledge, skills, and clinical thinking, which is affecting many across the paradigm of nursing. So subsequently, this is also affecting those currently employed in those critical care roles, those educating and orienting the new graduate nurses to that critical care role. It has almost become culture to expect these new graduate nurses to come into the workforce with the needed knowledge and skills to adequately perform in these critical care roles. But unfortunately, with that innuendo, we have seasoned nurses in the role of a preceptor that aren't fulfilling that role. Preceptors that develop this fallacy tend to not spend the needed time with the new graduate nurses and fail to provide them with the needed feedback and guidance. This lack of guidance can affect that new graduate nurse's overall learning experience, their abilities, and attitudes towards nursing as a whole, other staff members, and the patients, which in turn affects that patient care. And everything with nursing is patient-centered care. So that is huge. The facilities employing the new graduate nurses are absolutely affected, and then the patients who are cared for by these new graduate nurses. Everything kind of plays into the next. So the implementation of a flipped classroom is huge. So something that I have developed to help promote that flipped classroom is a Glogster. As a glog, but I did it on Glogster. As you can see, this is a very easy to use website that is easy to get out to the students. This puts all the information that they need on one page to prepare themselves. With my project, unfortunately, I wasn't able to do it in front of a class, which was the initial idea, to use a senior nursing class, critical care class. So I am using a pilot group of new graduate nurses that I am currently onboarding at the facility that I work at. And I provided this to them to prepare. So the idea of the flipped classroom is to have them prepare prior to, so when they come to you, they are ready to apply the knowledge learned. I pulled from YouTube videos that laid out what sepsis was, as I'm doing a focus on sepsis. What sepsis was, what septic shock is, the diagnosis and treatment. There's also a PowerPoint that I put together for them to go through, which is specific to the facility. And there's also the sepsis alert criteria that I was able to add, which is specific to the facility that I am doing this at. The next idea that I had to implement was using simulation. So everything that they learned from that GLOG, from that flipped classroom, they would bring to simulation to be able to apply it. So my mentor is the director of nursing for a BSN program, and she introduced me to Laerdal simulation and this LEAP learning application, which goes with these mannequins where you can build your scenario. So this is that first page that I come to with so many different things that are useful. And then the simulation that I am building for sepsis. And you can kind of see the whole process here. It gives scenario info, the scenario outline, which is for the instructor, gives a learner brief for the students, their objectives, and then an equipment checklist to make sure that's in the room. And it has different, you have what the initial vital signs are, and just depending on what actions they take, those vital signs can change. They can worsen or they can improve. So, I mean, the ideas, the possibilities are absolutely endless. And then finally, we just want to improve the orientation process in general. This project started off as building a critical care nursing course, and then it turned into focusing on sepsis, but it's really opened so many other doors at the facility where I am currently at, and I have educators, the lead educators, asking me for improvement ideas when it comes to orienting and providing education to the new staff and to those new graduate nurses, that's what we're hiring more and more of. That is the largest pool of nurses in the job force, are those new graduate nurses. So how do we prepare them to enter these critical care roles? So as far as outcomes, we want to improve the knowledge retention of that new graduate nurse in the critical care arena. We're going to do that by using that flipped classroom, because the flipped classroom is proven to increase knowledge retention. We want to decrease the amount of turnover within the first year of entering the nursing workforce for those new graduate nurses in the critical care arena. And we want to improve the orientation process for the new graduate nurses in the critical care arena. This is significant, especially for those senior level BSN nursing students. By providing them with this critical care nursing course, it's helping to set the standard for what is expected. It helps to better prepare them when they do enter that workforce to be ready to enter going straight into those critical care roles. The new graduate nurse is oriented to the emergency department is huge, actually, and oriented to any critical care role. But with that nursing department or the emergency department, I can attest to, and I've seen these new graduate nurses come in and not last because they have become overwhelmed because they're just hammered with so much information. So we need to develop a better way to orient them, to bring them into that role and give them that knowledge base that they need to be able to safely practice. And another big significant thing with this project was promoting the leadership as an educator. You have those leaders that are there. They're the disciplinary leaders. They're the ones that run everything. But then you have those leaders that they lead by example. They lead by helping to guide the learner in a way that the learner actually understands, as opposed to telling them or talking at them. By the use of the flipped classroom, they can learn everything, and then when they come in, they will be able to ask questions. With simulation, they can apply the knowledge that they have learned through the GLOG. But if they make a mistake, it's done in a safe environment, so it's not affecting patient safety, but it gives them that opportunity to learn from that mistake. And it is a better way to promote patient safety, to promote patient-centered care. The whole idea of this is to change the way that we educate. We want to change the way that educators approach education. We want to turn this into a learner-driven process, not an educator-driven process. We want to promote the spirit of inquiry, and we want to make better nurses for tomorrow. It is always assumed that nurses working in critical care roles have the most experience. But with those nursing shortages, the largest pool for the hire, is the newly graduated nurses. That first year post-graduation is the most stressful, and this is when those new nurses need the most focus. They are attempting to transition from student nurse to floor nurse, and instead of just going to the floor, they're going to the critical care arena, which is even more stress. This has contributed to the increase in the turnover rate and the lack of job satisfaction. So we want to make sure that we utilize a flipped classroom coupled with simulation during their orientation and residency to help improve the knowledge, the retention of knowledge, and the overall nursing judgment. That way improving confidence, job satisfaction, and improving the patient-centered care. I want to thank you for taking the time to listen. These are my references that I use throughout my project.